Good afternoon. Hello, my name is Michael Long, and I am producing this video to satisfy the course requirements for Module 6 of the Aspen University ADC610 Pharmacology for Counselors course. More specifically, this video will discuss what is medication compliance, some reasons for non-compliance, the risks of non-compliance, and strategies for addressing non-compliance with clients. I would like to begin by saying that we are very fortunate to be living in the modern age of medicine. There has never been a time in history where the capability to detect, prevent, and treat so many illnesses has been possible. Overall, patient longevity has been improving, providing that patients maintain an open and honest dialogue with their physicians. Many factors go into living a healthy lifestyle, such as diet, exercise, adequate rest, monitoring blood pressure and cholesterol levels, and of course compliance with any medication regimen that a patient may be prescribed. What is medication noncompliance? Medication noncompliance is a term that is used to essentially describe when a patient either does not fill or take medication as prescribed by a physician. The terminology is considered important because it highlights that a physician and a patient have worked collaboratively on the patient's treatment plan and that the patient is not following through with the plan. This may not only prevent the patient from getting better, but it may also interfere with the viability of any subsequent plans for follow-up care. What are some of the reasons for non-compliance? It has been estimated that about 1/3 of individuals do not take prescribed medication within a week after it is prescribed. Kirchheimer, 2004. And over 50% of prescriptions are not taken as prescribed, and over 1/3 go unfilled, according to Brown. So why do many patients not take their medications as prescribed when the benefits of doing so seem so obvious? For some individuals, the reason simply amounts to the fiscal reality that they just don't have the money to be able to afford their medication, and a combination of pride and ignorance prevent the individual from seeking alternatives such as lower cost generic drugs or asking for assistance. For others, they may dislike the side effects of a medication, lack a full understanding of their condition, start feeling better, or they possibly harbor fear about their medical condition. Forgetfulness is estimated to be the cause of over 1/4 of non-compliance. Stephen Grun, 2015. Add to this that older people also experience more memory lapses, often have limited access to transportation, and may even have difficulty reading the labels on their medications. I am only 47 years old, and I already have a lot of difficulty reading the labels on my medications without the aid of reading glasses, and this is only bound to get worse as I get older. It is also worth mentioning that many patients do not trust the healthcare industry because of contradictory information frequently being released that makes it appear that drugs are overprescribed and unnecessary. Brown. Furthermore, according to some patients interviewed by Brown in her video on medication adherence, patients report not being asked by their doctors if they are taking their medicine, or to lying when asked because they want to please their doctor. What are the risks involved with non-compliance? The risks involved with non-compliance will vary with each patient's specific medical condition, especially if other recommended changes in lifestyle are not adopted. For example, someone with a chronic condition like high blood pressure will deteriorate more slowly than someone with a life-threatening condition like diabetes or heart disease. The first risk is that a client may miss or skip doses of a medication. The second is that they may stop at taking it altogether and their condition worsens. And the third risk is that a patient may not receive effective follow-on care. In each case, the normalization of deviance takes a client further from the point where they would be heading if they were taking the medication properly, resulting in suboptimum health or decline in their state of health. Strategies for addressing noncompliance in clients. Physicians play a huge role in addressing noncompliance in clients. Doctors and counselors must be equipped with impeccable communication skills and not just an advanced knowledge of healing techniques. The quality of their relationship with a patient is as important as the medicine they prescribe or their knowledge of a medicine, as it fosters trust and confidence in the patient. This means listening and providing an in-depth explanation of the patient's illness and how the medication is expected to help them. Doctors who work in managed care settings where their earning is based on volume may limit their interaction with patients to increase patient flow, with the belief that the pharmacist is going to address the patient's questions concerning the prescription. I had a family doctor in Texas who used to call us about 2 days after our appointment to verify if everything was going well and ask if we had any questions. This not only made us feel better, but it also gave the medication time to start working, and it helped our doctor to verify that the medication was not having any unexpected side effects. I imagine for individuals not taking their medications, this could serve as a reminder to them to take their medication. Physicians and counselors should express genuine concern and empathy for the client and truly listen to their concerns in a non-judgmental way. Additionally, the range of available medications as well as the cost versus benefits and side effects should be fully explained when assisting a client to choose the best plan for them. The patient's schedule might suggest some strategies a counselor may suggest to help the client incorporate taking a medication into their routine. My mother-in-law, for example, uses a plastic pill organizer to separate her husband's pills for a 2-week period, and then she sets it in the open as a reminder. In our modern age, electronic devices can even be used to provide a reminder. In 2017, the first pill with an electronic sensor was approved in the United States, which is programmed to send a message to a provider via a Wi-Fi link as it is being digested to help them better monitor older patients. Lastly, considering medication noncompliance is so widespread, it is important that physicians recognize the problem and take steps to address it with their patients. I will conclude by saying that I am someone who has always taken their medication as prescribed. I found this to be a very eye-opening research topic into a problem that I was not aware existed. Thank you very much, and have a nice day.